I'm a radiation oncologist.
GYN oncologist.
Both a medical oncologist and a hematologist.
Physician who specializes in medical oncology.
Adult hematologist and oncologist.
I specialize in medical oncology.
I'm a surgical oncologist and I work out of the Zimmer Cancer Center at New Hanover Regional Medical Center.
I chose to be a medical oncologist and hematologist predominantly secondary to the fact that my mother was diagnosed with chronic lymphocytic leukemia during my first week of my internal medicine residency. This is without a doubt the main reason that I chose to be a medical oncologist.
When I chose to be a GYN oncology, I think you don't choose. I think the specialty call you. One day you just go through a moment when you say, wow, I just want to do this the rest of my life.
Since I was a kid, I always knew I wanted to be a doctor, but when I was in high school, I had my mother's youngest sister was diagnosed with metastatic breast cancer, and that really affected me. I knew at that point that I wanted to care for patients with cancer.
My mother died of breast cancer during my internship year. It showed me things about myself, and it showed me things about medicine that were kind of compelling, and when all was said and done, it took about 2 years after she died, I knew that's what I was going to do for a living.
I liked oncology when I was in my training. I liked the way that you get to know people and families at a level that is really intense and important in their lives.
When I did my training as an intern, we had to do a month on a ward for medical oncology, and I was just really encouraged by the patients and their courage and all that it took to fight cancer.
The reward we get as a surgeon, we really get in touch with the patient's feelings and emotions. We get to understand what they're scared of, what they're frightened of, and try and allay their fears.
There's this thing called the wheel of health. So it has the doctor, I give medicine, I give you the treatment, the surgeon does surgery or radiation. But then there's also the nutritional health, the spiritual health, and the physical health of the patient. And when you put all that together, that takes a great team and community support and other things, which we're able to provide here.
You need a very strong team that can wrap around the patient and wrap around all those fears and be there. Sometimes they just need to tell you how they feel, and you just need to learn to listen.
I think using language that everybody understands, avoiding medical terminology, and putting things in a way that's logical, and that all boils down to communication.
People need a lot of compassion, but they also need a lot of good, honest information about what's happening to them and what's going to happen to them and when it's going to happen.
The biggest part of our job, I think, is really allaying that fear and anxiety. If we can do that, the rest of the course of treatment is much, much easier. I've learned so many things from my patients that I think overall it's made me a much stronger person.
One of my fondest memories is of a patient that I met early on in my career here. She was diagnosed with a blood cancer. And so one of the options that we talked to the patient about was participation in a clinical trial. She and her husband have left behind this tremendous legacy of developing this new drug that has come to the forefront of the treatment of her disease.
I feel there are different ways to support cancer in the community, whether the community is big, small, or in between. Some people support financially, some people support by providing aid and assistance to people under cancer care. Others actually work as physicians in the hospital. I think I've been able to continue the legacy of my family by getting on the ground and working with people on a daily basis and helping them in their daily battle with cancer.
We have all the resources here that one needs to practice well. We have the physicians, we have the hospital, the nurses, the support system from hospice to the physical therapist to almost anything that you need. We have it and we can get it done.
You have very state-of-the-art expertise here and many physicians to actually help the patient get them through this disease as quickly and as fast as we can.
Local cancer care, surrounded by your community, your friends, your family, is dramatically different. It's much more helpful than if you're going to be away. If you can get great cancer care locally, there isn't anything better.
But being able to walk down that path with somebody is very special. Difficult sometimes, but special.